My name is Dr. Joanne Yanez. I'm the Executive Director for AANMC. And with us today, we have a bunch of our residency sites. And so I'm really excited to welcome folks today. Just as a heads up, participants are going to be in listen only mode during the presentation. If you do happen to have some questions while folks are talking or presenting, please do feel free to use the Q&A function and or you can direct chat to a site if a site is specific, if a question is specific to a site. We have let them know to check their chats. So if you do have a question directly for, let's say, one or two sites, you can communicate directly with them during the course of today. If you're having any technical difficulties, please do email us at events@aanmc.org. Next. So today is educational only. This event is not eligible for continuing education, and we do ask that content is not reproduced without permission. So we are going to be talking through a little bit of a timeline reminder, and then we'll jump right into the site presentations. Okay, so just as a reminder, phase one is one and done. Right now we are in the really the part where we're going to be getting ready for phase two. On January 29th, the application period actually opens, so you'll be able to start uploading your materials. So right now is really when you should be gathering all of the things, getting your recommendation letters started up, having any types of preceptorships that you want to explore various different sites. For those that do require that, this is a great time to do that during the holidays. And then just a reminder, if you have not yet set calendar reminders for yourself of all of these important dates, it's probably a good pro tip to do so. The residency and match periods, so the interviews will start March 30th, ending May 13th. And then May 20th, that's your deadline to submit your rank list. And that is a hard deadline. When that portal closes, it closes. And then we announce match on May 29th. As I stated, you can use the chat function to communicate directly with the residency sites you're interested in. If you have general Q&A, you can also just pop that in the Q&A section. Next slide. So we're going to have a number of sites with us. Uh, Today, we'll be starting with open wellness. So, and then moving through the remainder of sites. So, with that, we're going to go ahead and get started. Doctors Chang and Gurvich.
So I'm Dr. Chang. I am a NDLAC, and I'm one of the co-owners of Open Wellness. There's two wings to our clinic. There's a GI wing and a sports medicine, regenerative medicine wing. And I am the regenerative medicine, sports medicine doc. I will also be speaking for Dr. Gurvich today, who's the GI wing. But we'll start with mine first. Next slide. I am sports medicine and pain management focused. I do mostly, we work in an integrative setting. We have PTs and chiros in-house. And so we work as a collaborative team, most of our patients. And our role is emphasized on we mostly see pretty complicated patients that have not had success elsewhere. And most of the work that we do is revolved around MSK ultrasound guided diagnostic and procedures with injections, including perineural injection therapy, prolotherapy, PRP, stem cell. We do a little bit of IV therapy as well, but that's not our main focus. And I think the cool part is that we can work as a collaborative team. So you're getting feedback from chiros and PTs, and um, then we can sort of see a more well-rounded approach on how to treat complicated patients. And we offer internal and external rotations with people around the field. It's a 2-year residency. The first year is focused on building clinical skills around injection therapy and a lot of diagnostic skills, combining MSK ultrasound diagnostics with functional movement assessments. And the second year is to open up the scope of treatment. So then the resident will start doing injections, and we will also help prepare them for private practice. So we help them set up their business, set up their business plan, get them with set up with insurance credentialing and their bank account. So then when they leave the second year residency, they have a full practice of patients that they will take with them, whoever they want to take. There is no non-compete, and they have everything set up for their own practice, so they are ready to launch. And we don't, I teach whatever the residents want to learn, but I don't. I let whoever wants to walk on have a lot of freedom with our guidance, of course. But I welcome people to bring in their own style and flavors to how they want to do things. It's a heavy patient load based residency. I'd say my first year resident probably sees about somewhere between 20 to 25 patients a week, I would say. And then in your second year, people are seeing probably 30 to 35, sometimes 40 patients a week. Some of that will be with me, and then most of it will be by yourself. And so it's a very hands-on experiential learning. With mine, there is essentially maybe only 5% of it will be paperwork or admin stuff. It's all focused on growing clinical skills, especially around regenerative medicine and injections. And our goal is to get our residents up and running and ready to launch wherever they want to go when they're done. And we offer, I think our first year is 46,000 a year with full benefits. Second year is 48,000 plus bonuses based on productivity. I would say in the past, our residents make somewhere between 8 to 15,000 in addition to their salary. I will move on to open wellness for Dr. Gurevich, who is GI focused. She specializes in all things GI, but especially around how to manage IBD with naturopathic medicine. She's one of the original co-founders of the Gastro AMP. And her practice is mostly gastro, but being a naturopath in Portland, I think you end up seeing a small degree of managing everyone's overall health, endocrinology, women's health, etc. But I think as a resident, the skill sets she really wants you to be able to pick up is the GI part. Our clinic has a SIBO machine in-house. And so we run a lot of those, and there's going to be a lot of functional GI testing. With her, she does specifically case reviews, an hour and a half a week, and also there's some part of the responsibility is to help Dr. Gurevich run all her educational things. She does a lot of teaching, and so one of our second year resident ended up teaching the gastro class at the University of Western States. So there's a lot of teaching and learning opportunities there. And same thing, Dr. Gurevich does a lot of support. This year will be, whoever gets on will be her 16th resident. And so she's trained a lot of doctors through time. It's something she's pretty perfected, and all the residents before her has been remarkably successful. Next slide. Same thing. First year is the clinical skills. Second year is optimizing private practice skill sets and growth, whether that's marketing, networking, building up your business. We can help students do any of that. And the pay and the benefit package is the same as I mentioned before. And I think that may be it. Yes, perfect.
Excellent. Thank you so much. Okay, next up we have the Koa Clinic, please.
Hi, good morning. I'm Dr. Krinda Soto. I'm the owner and director of the Koa Clinic in Kailua Kona on the Big Island of Hawaii. You can see our beautiful island and town there. It's really common. We get rainbows. It's a lovely place. It's very sunny all year round. This is our team here. We have myself, another ND associate, as well as our current naturopathic resident, Chinese medicine practitioner, nurse practitioner. We also collaborate in clinic with some other MDs, a licensed midwife, and a lactation consultant. And we have a lot of connections in the community with other types of providers as well. Next slide. We do provide about 60% of our practice is insurance covered primary care. And within the clinic, we accept all forms of insurance, including Medicare and Medicaid. The naturopathic doctors are only, of course, not covered by Medicare, so we accept commercial insurance. And we do have a wide variety of patients. The youngest patient on my panel right now is, or that is on my schedule this week, is 1 month. My oldest patient just turned 100. And we do have a women's health focus, but really we do, whole family medicine. We do a variety of other things as well. We have some self-paced services such as hyperbaric oxygen, IV therapy. We are starting perineural therapy in our clinic as well now, thanks to Dr. Gervich. And we do have some membership patients as well. Really, we're trying to just serve our community, which is just an incredibly underserved community. So you will spend time, if you can go to the next slide, in your first few months shadowing, but also seeing acute patients right off the bat. We kind of just want to get you in there and getting experience right away. You'll also have the opportunity to shadow with me as well as the other providers in office. I'm sorry, actually, I think you need to go back one so that people can see about the benefits. Our salary and benefits, annual salary this year will be $55,500. You get 10 days per year of PTO in addition to our holiday closure days, and you will get paid attendance at the Hawaii Doc Talks conference, as well as some shared room and board. You also will be supplied medical insurance and your malpractice insurance as well. By the end of your first year or your only year, you'll be seeing probably about 30 to 40 patients per week, establishing your own patients by the end of the year. We do, as I mentioned, live on the Big Island of Hawaii, which is a very underserved community. We're on a literal and figurative island in terms of healthcare. So, we really learn to do a lot here, and it's incredibly important that applicants are interested in applying to our clinic because they care very deeply about trying to help support and improve the community in which they live and learn about the local culture and customs. You can think of it here as another country because culturally it is another country. But you'll still get plenty of time, of course, to surf, swim, paddleboard, hike, etc. And we do support people to have a good balanced quality of life here. Last slide. Um, it is highly encouraged to come visit us because part of moving here is not just the clinic, but of course the environment and experience of living in Hawaii itself. So please do come visit us. You can email our admin front desk to coordinate. And I also provided the email address here for our current resident, Dr. Gail Robison. And since I have just a couple seconds left, I'm going to show you the volcano, which is going off right now. You can see how incredible it is. And thank you very much.
Hey, we're going to tee up the next site, please.
Hi. Sorry about that. This is Dr. Alice Nguyen. I'm the Residency Director and Medical Director of Stark Health. This will be our fourth or fifth residency cycle that we're participating in AAMC. And let me just see here real quick. And if we just go to the next slide. By the way, we're located in Newport Beach and Tustin in Southern California, Orange County. And we are an integrative, 360 integrated healthcare practice where we have a team of NMDs, chiropractors, mobility specialists, as well as health coaches and a team of strength coaches as well. So we only have one-on-one training at our facility. It's not an open gym format. Next slide. Here. Great. The conditions in which we treat at our practice is cardiometabolic mostly. Most of our patients come to us wanting to lose weight, but also to ensure that their health span matches their lifespan. So there is a small amount of autoimmune patients that we do see, hormones, as well as some GI. We do treat acute infectious diseases with IV therapy as well as herbs and supplementation, and we'll be using, of course, everything that's listed there. We do have an on-site DEXA machine to assess for body composition as well as bone mineral content. We will also utilize pharmaceuticals and peptide therapy when needed and indicated. So our population is between 35 to 65, and this is from professional athletes to first timers. We don't really see chronic complex disease. So all of our patients are actually highly motivated to really kind of make changes in their lives. And it's a very happy population for the most part that we're working with, as well as the team that we collaborate with within the company. So patient contacts averages about 25 to 30 per week. And for the first few months, the resident will actually be shadowing me, really kind of ramping up their catheter placement skills because we do a fair amount of IV therapy. Now, there is a requirement. All applicants must complete a 40-hour preceptorship to be considered for the residency. So it's a very, very specialized type of practice that's truly team oriented. So the applicant, we have to basically see how you mesh well with our team. Next slide. Benefits are listed here. In California, the salary will be $70,304 for the year. What's included is health, dental, and vision insurance. After the first year, if the resident gets offered the full-time associate position, 401k matching is included. And their ancillary benefits are actually listed there. So there is personal training, full gym access for the resident, chiropractics and soft tissue mobility training. They have their own personalized nutrition plan. We offer immune IVs for acute infections without charging our employees. And ND care is also included, but that's optional. So the retail value of the ancillary benefits add up to about $25,000 a year. And that's it.
Thank you so much. Integrated Health Clinic, please.
I can get started for integrated. So I am Dr. Sydney Moffat. I am the current resident of Dr. Gurdev Parmar at Integrated Health Clinic. We work out of South Surrey in British Columbia, Canada. It is an oncology residency. It is 2 years. I'm about 8 months into my current residency, so this site will not be open again until spring of 2026. Our therapies include whole body hyperthermia, local regional hyperthermia. We do a lot of IV vitamin C therapy, ozone, mistletoe, and then subcutaneous mistletoe as well, on top of the usual supplements and prescriptions. A little bit about Dr. Gurdev Parmar himself. He has over 25 years of experience in integrative oncology. He wrote the textbook of naturopathic oncology. He taught us at Boucher. That was my first introduction to naturopathic oncology and what initially got me very interested in this field. He does a lot of research out of our clinic, and he just began the PRISM Foundation as well. I do apologize. I'm very sick right now, so just bear with me. Our approach is always, of course, whole person individualized care. We work alongside standard of care, so patients going through chemotherapy, radiotherapy, that also has a big impact on what we do to support our patients through their standard of care treatments. And it's very research driven, so we do a lot of research on our own patients, and we also follow research to guide our therapies. Next slide, please. Thank you. So some of the skills that you can expect to develop at Integrated, my schedule currently is 3 days a week in office with Dr. Parmar, seeing patients. We see a very heavy patient load, and then 2 weeks or 2 days of the week I'm in the lab doing IVs and doing those kind of therapies. So you really get an opportunity to develop all sorts of skills. My clinical skills have been very largely developed in IV therapy, in injections, in blood draws, also getting to use those local regional hyperthermia machines. I'm very familiar with those and how they work and how to explain that to patients. Working alongside Dr. Parmar in office has given me the opportunity to learn all the ins and outs of charting, of writing referrals, of doing requisitions, everything that comes along with the backside of patient care. And then we also do research. So I'm doing a lot of data collection, writing up case reports, learning everything that goes along with putting research out into the world. And also a lot of time management. As I said, we are a very high volume clinic. We see a lot of patients. So being able to manage time well has been something that I've been able to largely develop as well. Next slide, please. So who should apply? Anyone who is interested in integrative oncology. This is a very rewarding field to work in. Being able to work alongside Dr. Parmar in patient visits, but then also see patients in the lab and get to speak with them directly and learn how much of a difference our therapies are making has been just an amazing experience for me. So anyone who's interested in integrative oncology should be looking into this residency. Those who want to develop their hands-on clinical experience, like I said, doing the IVs, doing the local regional hyperthermia, all those therapies. And those who are looking for a really fast-paced, collaborative environment. The last things I'll say, I know I'm reaching time closely. The salary is 55 for the first year and 60 for the second. In the first year, I am simply doing charting and whatnot for Dr. Palmer. In the second year, you will begin to see patients on your own. And that's everything. Thank you.
Wonderful. Thank you. And I hope you feel better.
Thank you.
Next up is Vermont.
Hi there. Dr. Jessica Statmauer. I'm a 2002 graduate of NUNM and co-owner and director of the Vermont Naturopathic Clinic in South Burlington. Next slide. As a person born and raised on the West Coast, I didn't have a lot of information about the region before moving here. So just to briefly orient you guys, South Burlington is located in northern, you skipped a slide. Oh, no, right slide, sorry. We're located in northern Vermont. We are in the Champlain Basin, so we've got the Adirondack Mountains to our west and the Green Mountains to our east. We're about 90 minutes from Montreal and about 3 hours from Boston. And Burlington itself is a really small, vibrant, progressive city with a strong focus on supporting local culture and business and quick access to the lake and mountains. And as a naturopath, Vermont is a great place to practice. We have our broadest scope of practice of most states. NDs here can function as fully accredited primary care docs with similar privileges to our MD colleagues. And most of us in the state do some version of primary care. Next slide. So my clinic, the Vermont Naturopathic Clinic, we have 5 doctors in our practice, one of which is our second-year resident. Between our 4 senior doctors, we have about 75 years of combined naturopathic experience, and 3 out of our 4 doctors do acupuncture as well. We're a family practice, so we see people of all ages. About 40% of my practice is pediatric primary care, and we see a large population of pediatric patients for primary and integrative care. We offer well child and adult checkups, immunizations, immunization counseling, acute services, and care for chronic health conditions. Because we're a patient-centered medical home, we also have a therapist embedded in our practice that our patients can see at no cost to them. And then we're a major destination for people in the area seeking out functional medicine, as one of our doctors primarily focuses on SIBO, IBS, and inflammatory gut conditions. We also have a full pharmaceutical formulary at our disposal. Next slide. So that's a little bit about our clinic. The residency is a 2-year, mostly patient-facing residency. It's very hands-on. Until you're credentialed with insurances, you'll primarily be seeing patients with me or one of the other docs. After you're credentialed, you'll be seeing patients on your own. In the first 3 months of practice, our resident had over 370 patient contacts. In the first year, over 1,200 patient contacts. And now 2 months into her second year, she's seeing on average 8 patients a day, so high volume. We would expect you to see a lot of variety. So being in primary care means wearing a lot of hats. While we're kind of focused on naturopathic medicine, we're also at the same time wearing the pragmatic hat of providing the service the patient needs at the time. So sometimes you'll be elbow deep in detox and lifestyle medicine, then you'll be adjusting a thyroid dose, then you'll be collaborating with a high school drug and alcohol counselor, then prescribing an antibiotic. So a lot of variety. Though we're a naturopathic practice, many of our patients are taking multiple pharmaceuticals. So it would be helpful to have an interest in developing those skills in your practice. In short, our residency would be well suited for someone who enjoys a faster paced environment, who wants to do pediatric, adolescent, and adult medicine, and who wants to gain experience in chronic GI conditions, but also a really strong foundation in primary care. As a culture, we work really hard on a day-to-day basis, but keep a relaxed and professional atmosphere. So I've included some pictures of our clinic pups. And I would welcome you guys to contact me with any questions. If you find yourself in the Burlington area, please consider coming to Precept. Thank you.
Thanks so much. Next up, we have Champlain Center, please. And you can go to the next slide.
That is me. Hey, everybody. Thanks for coming through on a Saturday. I know it is rough out here, at least here in Vermont. It's cold. I'm shivering. I don't want to put on that heat too high. Anyways, my name is Amanda Daniela Garcia. I'm a third-year resident at the Champlain Center for Natural Medicine, and we're in Shelburne, Vermont. So it's a great follow-up to Dr. Stodmeyer. Next slide, please. So really, I'm just going off the back of Dr. Stodmeyer because primary care is a big piece here. You're going to be seeing a lot of different things. At the clinic, you'll see various cancer diagnoses. You're going to be working with Dr. Bill Warnock. And so he actually has like #1 in the Vermont naturopathic like licenses because he helped facilitate the like passage of legislation for uh, naturopathic doctors here, which is super cool. So you'll see pediatrics, you'll do IV therapy. I run 2 IV shifts throughout the week, Tuesday and Thursdays, mainly doing high dose vitamin C, sometimes lactated ringers for hypotension, POTS patients, sometimes Myers cocktails, sometimes glutathione. You'll see Lyme disease for sure, and their co-infections. And you'll be taking blood. Every day I do at least 4 blood draws. So gotta like poking people for sure. Next slide, please. And so I think in general, even if you don't like consider Vermont, you're like, that is not on my list. Some things to think about when you're thinking about residency is location. Do you want to be on the East Coast? Do you want to be on the West Coast? Do you want to be north, south? Those are big things. I was born and raised in New York, so I knew I wanted to be on the East Coast, close to family. So think about that. Also, population served. Here in Vermont, because we accept insurances, you see people, Blue Cross Blue Shield, private insurance, Aetna, Cigna, and also Medicaid. So you get people throughout the gambit. And you just got to ask yourself, do I want to be working with all populations, or do I want to be in a place that's more cash based where, you're getting a different population there because those are people that can afford your services. Scope of practice. You're going to see a lot of different things. Acutes will be on the schedule for sure every day. In terms of primary care, just as Dr. Stodmeyer said, gotta want to be seeing babies, toddlers, adolescents, adults. Everybody comes through the door. Now, another piece, driving. This may not seem like a big thing for some people. For me, growing up in New York, it was because I'm a pedestrian. So if you don't like to drive, I don't know about Vermont, y'all, because you're not going to be able to see all the cool things without a car unless you make friends, which what I ended up doing. So all my friends got cars. But if you want that autonomy, think about that. Winter. It's already winter here. It's cold. It's dark. I get off work at 5. It's pitch black. If seasonal depression is a big one for you, something to think about. How are you going to support yourself in that environment, And maybe it's not a deal breaker. That's okay. And then the insurance model again, Medicaid, all the other ones. Last slide, please. I already see Dr. Yanis. She's like, stop talking, Garcia. I'm almost done. And then that's a beautiful pic of our team. And we're cool, we're fun, no real drama. So if you have any questions, you want to email me, please do. It's a great clinic. Just got to figure out if it's a good fit for you. All right. Thanks for your time.
Thank you. Next up, we have neighborhood naturopathic, please.
Hi, everyone. My name is Grace. I'm one of the naturopathic physicians as well as the residency program manager here at Neighborhood Naturopathic. We can go ahead and go on to the next slide. We have a practice of 9 physicians as well as a nurse practitioner, and then that 9 doctors includes the 2 residents that we have a part of our team. We provide primary care for all ages, so babies on up. And then we're also an insurance-based practice, but we do see patients who pay out of pocket if we don't take their insurance. We're open Monday through Saturday, and we provide a wide range of services. This is a short list, but we do provide some allergy testing and treatment, including sublingual immunotherapy and allergy injections. We do phlebotomy, we do fibroscans, we do pediatric vaccinations because a large part of our practice is pediatric primary care. This residency, we're really looking for someone who is interested in primary care because that's really what we're doing every single day. And so making sure that you're interested in seeing pediatric patients is really important, because one of the people you'll be working with directly is Dr. Emily Lesnick, and over half of her patient population is children. And so having a passion for seeing kids would be really important, as well as being excited about GI health. So Dr. Megan Taylor is another one of the directors that you'd be working very closely with. And she sees lots of complex chronic GI concerns. And along with that comes MCAS and dysautonomia and long COVID. And so we're also treating a lot of complex chronic conditions. And so because there is nine of us, all of us have done residency. We're all really excited to learn and support the resident. You are able to shadow all of us. And so that's mostly what you're doing, especially that first quarter, is doing lots and lots of shadowing. And then as you feel comfortable, as your license comes in, then you'll be able to take on more of your own patients, being able to see patients by yourself. And we are really supportive of making sure that you are getting the education that you really want and making sure that you're excited about the patients that you're seeing. Um, and then we are offering 55,000 for the salary, and that also includes medical benefits, including dental. And then we do also offer a continuing education stipend of $1,000 per year. And from personal experience, that gets you quite a few CEs. So that's, I think, a really cool thing that our office is able to offer. And then we also do cover malpractice insurance. And then you get 80 hours of flexible PTO and 40 hours of sick leave. I think this last slide is our contact information. So feel free to reach out to Dr. Lesnick, Dr. Taylor, or myself. If you have any questions, if you'd like to shadow, we are really wonderful team. It's a really amazing office to work in, very supportive. We have a few MAs, we have a great admin staff. And so having you all come and shadow is a really great way to learn our environment, see if we're a good fit for you. Yeah, let us know if you have any questions.
Fabulous. Thank you. Collaborative Natural Health is up next.
Thank you so much.
Next
Hi there,
slide.
guys. Hi there, guys. I'm Dr. Lauren Young. I'm the founder of Collaborative Natural Health Partners and one of the naturopathic physicians. So we're in Connecticut. Connecticut is an interesting scope of practice, right? We can take insurance, we can diagnose and treat, we have a licensure, and yet our scope of practice is limited where we can only use a natural medicinary, no prescriptive rights. But, it works really well in our practice because we are alongside conventional medical doctors and APRNs as well in our setting. So you have the access to a full scope of practice and you get to learn what it's like to practice in Connecticut. So it's actually been really wonderful experience to have residents with us. So there's 12 of us, 5 locations, and also board certified family medicine doctors and APRNs. Next slide. So we're based out of the greater Hartford area, and we do have some satellites at outskirts. I know the slides are lagged. And we've been doing this residency for quite a while. There's some of my residents. With our partnership with NERC, we're able to also, and our relationship with the hospital, we're allowing our team to our residents to go and study and with other clinicians. So Dr. Gonzalez went and studied with a general surgeon. She also went in with a um, orthopedic surgeon and also a cardiologist. Our current residents queuing up to study homeopathy more in depth, but also then looking at going in with a GI doctor for a while. So you're in our office 4 days a week, but then also you're studying in the community. Our hospital is super cool. In 2018, they changed the bylaws to bring naturopathic physicians to doing inpatient care. So we actually do inpatient care in our local hospital as well as our outpatient clinics. Our setting is typically we're all in these different locations. The resident can kind of choose where they want to be and who they want to study with. Typically, you rotate with 4 different clinicians, one every different day. And then we connect on grand rounds and different projects once a month. So we have a podcast, we'll do different health fairs and different conferences as a team. And usually, like again, once a month, we're doing a grand rounds as a group together. So, next slide. Um, because there's so many of us, there's lots of modalities. And so every resident that's passed through our clinic really has had a different experience tailoring it to what they want. So some specialize more in GI, some more in oncology, some more in tick-borne disease. We have a myriad of modalities afforded to clinicians to experience and strengthen their skills in. At the same time, we're not expecting our docs to do IV clinic shifts or phlebotomy or any of those things. We have in-house phlebotomists, we have nurses for the IVs, those type of things. So it's a really great experience where we can tailor your interests with our clinicians that are already on the team. I'll say most of the residents so far have stayed on with us. So we've got a couple in this photo, Dr. Holland, Dr. Gonzalez, currently Dr. Congdon is with us. So it's a really wonderful experience to practice in a group and really nurture each other's skill sets. Next slide. The salary currently is at 45, but possibly increasing for next year. And I don't really put a cap on CME. It really is depending on what you want to explore and how it's going to nurture the clinic and yourself. So I'm open to whatever that looks like. Typically, it's 4 days a week. Again, you're assigned to 4 different doctors and you're seeing patients that day. Since we're insurance-based, we're looking at anywhere from 8 to 16 patients a day. 16 would be the most. And we typically take on projects during that time as well. So it's been a really fun experience having a resident in the clinic. I'm happy to have you guys reach out and talk to our former residents. And if you want to shadow or even do some virtual hours with our clinic, would love to introduce you to Connecticut. It's a great place to be. Next slide. We're in between Boston and New York. It is cold and dark, but not quite as cold and dark as north of us. Yes, it's a limited scope of practice, but honestly, it lets us practice naturopathic medicine. And if I wanted to use low-dose naltrexone, I have an APRN consult the patient, and they get to use low-dose naltrexone, and I don't have to navigate that piece of it. I really love our scope, actually, to be honest with you, and it's a really fun place to be in our clinic. That's us. In one photo, cold plunging, and another photo, we did a pickup soccer game after we went to a farmer's market. It's a really fun group, and it's been really great to learn together as a team. So would love to host some other people. And if you're interested, there's a form to study with us on our website, and I'm happy to connect you with our residents or talk to you myself. Thank you so much.
Thanks, Dr. Young. Next up, we have Integrative Medicine LLC.
Yes, hi, my name is Dr. Mitch Morrow. I'm a medical doctor, naturopath, and osteopath. A bit of a combination for a lot of primary care. We are based in Virginia Beach, Virginia. This practice is young. It's only 1 year old. We were in Vermont previously for 8 to 9 years. And we were dealing with insurances previously in Vermont. And this practice is cash-based only. I do work with my wife, Anne, who is the practice manager. We have Kim, who is a registered nurse, and we are welcoming Dr. Torres, who is a naturopath, in January, and we're very excited because she also does nutrition. So integrative medicine is definitely the combination of primary care, conventional medicine, allopathic medicine, with physical medicine. I do practice as an osteopath, and of course, naturopathic medicine, functional medicine. Being an unlicensed state, this is definitely a challenge for naturopath, but it forces you somehow to be extremely good on the ground. And our place, being cash-based, being integrative, definitely is able to train residents for the best in the state. Next slide. So just to describe the practice, it's about 1 minute away from the general hospital. So we do see people from the emergency room after they've been screened out there. They sometimes wander into our treatment room. We have an IV room for cancer support. A lot of the naturopathic modalities are being used here. Nutrition, we use repurposed drugs because a lot of people come sometimes between cancer treatments or away from cancer treatment, and they do expect to be offered a different management, which is very challenging. This is why you need to be pretty good in primary care. We do longevity, anti-aging medicine as well. I tend to see more and more ladies with menopausal symptoms. This is a big thing now for the practice. And of course, we do immune therapy. We work with mold, Lyme disease. We do wellness, lifestyle. And we do offer a lot of injections, not just for pain, but also for energy boosters and weight management. We do the GLP-1, amongst other things. The osteopathic room is this is my room, actually. I was trained as an osteopath in England. So I do a lot of physical medicine and also injection therapy and regenerative medicine, including PRP and prolotherapy, and also a French modality of treatment called mesotherapy. In the US, it's used for anesthetic medicine, but I do use it for musculoskeletal medicine. Therefore, there's a lot of hands-on treatment pretty much every day here. In terms of primary care, obviously, even if you want to run away from primary care, this is always here. Patients do come from different backgrounds, and you have to be prepared. You have to know your pathology, you have to know your pharmacology, and you have to know your clinical algorithms. So this is where I come into the picture, and I do train the resident to be ready for everything. I have to keep an eye on everything that goes on the practice because the naturopath is not licensed per se, but this gives me an opportunity to help someone to develop. So if you want to know a little more, do look at the website and call Anne or Kim, and they will let you know a little more about the practice. Thank you.
Thank you so much. Hey, next up. Yeah.
All right. Hi, I'm Dr. Olinger. I'm the clinic director at Whole Systems Healthcare, the Portland Clinic. Whole Systems is a 501c3 nonprofit, so we're a really unique structure in that way. And Whole Systems, as a nonprofit, has multiple locations around the country. The whole mission and vision of Whole Systems was to develop more opportunities for integrative providers post-graduation. So we have a residency initiative as part of that. We're trying to create education branches for continuing education. We have a research branch for continued research into our medicine. And of course, we have a clinical branch, which is our clinics. Portland Clinic was one of the first Whole Systems clinics, but we've now expanded, and there are clinics in Ohio, in Florida, in Baltimore, and in Hawaii as well. And so if you are here with us as a resident, you will also have opportunities to work in and with those other clinics, either through shadowing opportunities and such. So we always encourage that. This is our current team at the Portland Clinic. So Dr. Valerie Kovach was one of our earlier residents, and she stayed on with us, and it's wonderful to have her. Vanessa Van Horn will be joining us as a chiropractor, but she's been working with us for years. And Lucian doesn't have a photo, but he's our wonderful front staff assistant. And Valeria Ortiz is joining us as well. We're primarily naturopathic, and we're primarily primary care. And the other half of my practice mainstay is integrative mental health. So that probably makes us fairly unique. You'll see a lot of mental health patients in all sorts of progress and distress. And so we really prioritize mental health in ourselves first and in our patients, of course. So some of the things you might see us use, you might get experience in practicing, will be kind of the annual screenings, wellness exams, mostly adults. We do a lot of HRT and endocrine work, internal medicine work, and primarily, and this kind of goes because mental health has a lot of overlap in chronic pain. We see a lot of chronic pain conditions, chronic infections, ME/CFS, POTS, dysautonomia, that sort of thing. And some of the modalities are things you might see in a primary care practice. We're doing pelvic exams, we're doing blood draws, we're doing blood draw reviews, nutrition support. As part of the mental health practice, a unique modality you might see with us would be Spravato and ketamine therapy. We were one of the first naturopathic clinics to offer Spravato therapy in Oregon. I should have mentioned that we're in Portland, Oregon. And so that's a unique thing to be able to offer, and it's covered by insurance, which is great. One of the things that drives me in my practice is increasing access to care to underserved populations. And I think we're probably one of the more affordable practices to offer this type of therapy to people who really need it. We do IV pushes and injections, but we're not quite an IV clinic. And because Dr. Kovac is also a chiropractor, you'll see lots of physical medicine. I'm going to run through this. We are an INM site, so you will get competitive income. You'll get benefits to shadow all of the INM residency sites. There's a bunch in Seattle as well and in Vermont as well. And as a whole systems employee, our nonprofit income does qualify for public service loan forgiveness at this time. And you get to engage in lots of research opportunities and opportunities to shadow with some of our other clinics, like I said. I think I'm out of time, but feel free to message us. You can find our contact information on our website or message me in the Q&A.
Thank you so much. On how you're up next.
Hello, I'm Dr. Victor Yusov. I am just finishing up my second year residency at On How Clinic. We'll be talking on Dr. Vickers' behalf. Dr. Vickers is an incredible physician. She's been in practice for 40 years now, so she has a wealth of knowledge. She has two clinics, On How Clinic and IEP. Both are nonprofit. You have the opportunity to work at both. On How is the main clinic where you can work. IEP is the sort of low-income population-based clinic that sees a lot of adjunctive oncology, autoimmune, neurodegenerative diseases. She's trained a number of residents since 1999. We see a wide variety of complex patients. I already mentioned oncology, women's health, hormones, autoimmune, and she's now starting to do mold and mast activation syndrome. You get a lot of experience with injection therapies like perineural injection therapy, neurotherapy, and prolotherapy. So if that's interesting to you, I would definitely look into this residency. Next slide, please. I also want to mention that Dr. Vickers also has her own line of herbs and supplements, both Western and Chinese medicine. So if that's something of interest to you, wanting to go into that field, you definitely have a lot to learn if you are interested. This residency is for both or either a dual ND LAC or a standalone ND. And like I said, it is a nonprofit. So if you're interested in the public service loan forgiveness, this will apply towards that. Next slide, please. Dr. Vickers lets you explore all the modalities that you want to learn, if she does them or not. So for example, I really wanted to get into craniosacral and microneedling, and she allowed me to do all of that. So that's fantastic. You get to spend a lot of one-on-one time with her. You get pretty much 2 days a week with her, 2 days a week seeing your own patients. On your own, you see about 10 patients a week. We also do 1 hour meetings 3 to 4 times a month where we talk about cases or any questions that you may have about any of your patients. Next slide, please. You earn about $45,000 to start, but there's definitely the potential to earn more. I definitely did within my first and second year earn way more than that. I want to say that this residency is fantastic and I learned a ton. I just finished and I started my own practice. I've been in my own private practice now for about a month and I feel like an actual doctor. I feel ready to start my practice. So if this is an interesting residency to you, I would reach out to her and get connected. Thanks.
Excellent. Thank you so much. Centro de Salud Familiar is next. Dr. Rogers or Ellie Rogers.
Hello, everyone. This is Eli Rogers. I am the office manager and residency coordinator for Centro Médico y Salud Familiar. We have 2 locations in Phoenix, Arizona, and 1 in Mesa, Arizona. Both of the locations have been established for a few years now. The one in Phoenix has been like 15 plus years, and this one here is not 7 years in Mesa. I wanted to show you a video to hear directly from the residents, but I don't think it will play, right, Stephanie? Either way,
you can include the link to the YouTube video. If there's a YouTube link, we can send that out later.
Send it out. Okay,
yeah.
Sure. And then you can hear directly from the residents about their experience. Dr. Messier has trained over 6 or 7 residents in the past 8 years, and most of them have stayed with us. They just stay and they keep working with us and expanding with us. So Some of the clinical services you will experience is family medicine. We are an integrative model with conventional and naturopathic medicine. And we see 4 years plus, kids 4 years and over. We do see a lot of women's health, including pap smears and well woman checks, hormones, hormone replacements, as well as men's health. We are doing testosterone. We gotten our own DEA licenses, and um, there is also a lot of IV therapy that we do here, although we are not a IV clinic, but a lot of our patients are getting hydration IVs and anti-aging IVs and other types of IVs that we're doing here. Injections, anywhere from antibiotics, anti-inflammatories, muscle relaxers, vitamin injections. We currently have the NAD Plus and other new vitamins coming out. We do minor procedures here in anywhere from sutures to eye objects removal. We also remove toenails, ingrown toenails. Every patient that comes through the office gets an EKG. They do teach you on the first week of training how to read an EKG, also how to handle any emergency cases if those come through. We have a full house in-house laboratory. We also have a pharmacy on site. We package our own supplements and medications. We have a license for everything that we do in our clinic. We do meet any AANMC requirements, naturopathic focus. So if you go to the next slide, please. We currently have 4 doctors in our clinic. Dr. Messier from right to left, Dr. Messier, Dr. Bouchard, Mendez, and Dr. York. They all been here. They did the residencies here. Now they've been here for more than 4 years. Dr. Messier here has been more than 8 years now. The reasons why you should choose our residency site. You'll be working with experienced physicians, hands-on experience. We do treat the Hispanic culture, so Spanish is a must when you come to do our residency here. You'll be learning from a lot of the experienced doctors. I think there's another slide. These are both of our locations here. One is in Mesa, one in Phoenix. Like I said, they're both bilingual primary care clinics. There is a very high patient flow, so you'll be seeing about 30 to 35 patients per week. There's a lot of opportunities to shadow before the residency. Am I done in time? I'm not sure if yeah.
We are
Okay.
about at time. Thank you.
Sure. Yeah, check us out. There's our website. I'm going to share our website on the link, and then you guys can reach out to us.
Thank
Okay.
you so very much.
Thank you.
Okay, next up we have, I believe it's Sonoran.
Hi, everybody. My name is Dr. Suko. I am the new residency director here at Sonoran. Yes, you heard that correctly, the new residency director. So I'm going to share to you today our Sonoran network. Next slide, please. So one of the clarifying things that I did want to mention up front is really the difference between an institutional versus an affiliate resident. So an institutional resident are those who are employees of Sonoran, and you'll be working at our Sonoran clinics versus those who are affiliate residents. You will be an employee of the private practice and you'll be overseen by Sonoran University. So I just want to clarify that up front. So at Sonoran, we do offer 3 types of residencies. We have the general medicine residency, we have the regenerative medicine residency, and then we also have the homeopathy residency. So by the time you apply for the fall setting, we're going to be offering 2. So it'll be the year 1 general medicine residency, which is a comprehensive primary care focused residency, versus our regenerative year 1 residency that is more focused on non-opioid pain practices such as prolotherapy or PRP injections. But that said, despite whether you are at the institution or an affiliate resident, you'll have the shared network. So in that sense, you'll have access to our library resources. So despite where you're at in terms of the year or whatever residency track you're on, the experience is going to be the same. You're going to be working directly with our physicians to oversee patient care in a student setting. And you'll also be working with students not only in the clinic, but also in the classrooms. So you'll be guiding students through their developmental skills practice in the classroom setting as well as in clinic. You'll also be meeting with me, the residency director, on a weekly basis, and we'll be talking about anything in regards to logistical stuff or didactic exercises such as case presentations, or I invite a guest speaker to talk about a certain topic or a particular case. So there's ongoing learning as you're making your way through your journey through our residency program. As well as the workload for residents. So this is a typical year one projected workload. So for our first year residents, you'll be assigned to 6 4-hour rotations. You'll also be assigned to on-call rotations in case another provider calls out, you'll be asked to cover that rotation. As I mentioned earlier, you will also have weekly logistical meetings and didactic meetings. There's also opportunity for additional scholarly activities such as publications, case presentations, and another area of interest that we are bringing back is grand rounds as well. So that is something of interest as well. And so on a typical given week, we will be expecting anywhere from 46 to 48 hours of work from our residents. Next slide, please. And here is the contact information. If you all have any questions in regards to the Sonora network, please feel free to reach out to me. Here is my email, my phone number. So please let me know if you have any questions. Thanks, everybody.
Thank you so much. And last but not least, CCNM.
Hello, everyone. I'm here to talk about the Canadian College of Naturopathic Medicine residency programs. If you can move to that first slide, that'll be great. So if you want to come to Canada, we have 2 opportunities in the clinical education realm within the institution, both in Toronto campus as well as the campus over in British Columbia. Essentially, if you are interested in an opportunity to see a diversity of patients, both as a clinical supervisor or as a mentee with a clinical supervisor mentor, or working with your own patients, because you'll also have an opportunity to see patients, schedule time to be able to do that. Consider coming to CCNM. The other thing is that there is an opportunity to participate in several classes where you are practicing and nurturing the skills of students in building their clinical skills, their developmental skills. And you've probably heard the see one, do one, teach one. Well, once you do that, you really know your skill set and you're able to apply it quite directly with patients. The other thing that you'll see within the CCNM clinical residencies is that you will be supported because we have a pretty good infrastructure for research. So there are research projects that are ongoing. You might have your own interests in research, and we certainly encourage you to nurture that. And we've had residents certainly perform or present, I should say, at the different naturopathic conferences. So I want you to take that into consideration. There is a modest salary. It's about $45 for the first year, and then it goes up to over $50 for the second year. And there are also other benefits that you do see, which includes health benefits, continuing education, etc. So when you move on to the next slide, I'm going to speak specifically about the Toronto campus, and then I'll speak about the Boucher campus. So the Toronto campus is a 2-year program, and there, as I mentioned before, you will have an opportunity to develop and maintain a private clinical practice. So in the first year, you'll have half a day devoted to doing that, and then 1 full day away from the educational institution in order to do that. Even though you might have written NPLEX, you will be required to write the College of Naturopaths of Ontario's exam. And then also the other caveat is if you want to have full scope of practice, then you will need to have at least gotten or have education in acupuncture TCM. If you move on to the next slide, I'd like to talk about the Boucher campus. The Boucher campus, which is over in British Columbia, is a one-year program. And within that 1 year, you will have the same opportunities as mentioned in the initial slide about the clinical features. Once again, half a day building practice and then a full day in the second year. But you are spending quite a bit of time in clinic as a clinical supervisor, a clinical mentor, clinical mentee, and that sort of thing. And so when we move on to the last slide, which is really the introductory slide, I just wanted to draw your attention to a haiku that was created by one of our former residents. Essentially what it says, and you can't read it right now, is it says, building confidence, mentoring and patient care, a better doctor. And that's really the experience of Dr. Fontes, who was the president of this, the Canadian Association of Naturopathic Doctors, a leader in Canada in naturopathic medicine. So I just want you to take that into consideration, no matter which residency you decide to go to. So thank you very much.
What a wonderful way to end. A haiku.
Okay, let's go ahead and see if Jessica Horton is with us. Natural Medicine of Seattle.
Yes, I'm here. My name is Jessica Horton. I am the clinic manager over at Natural Medicine of Seattle. We are located in Seattle, Washington. Our clinic is a part of the INM residency, and this will be our 14th year doing residency. As far as a new resident, we're looking for someone who basically knows how to ask questions, reach out for the help that's needed when they need it. Someone that, kind of understands the kind of questions that they need to ask in order to achieve their end goal as a new doctor and to help them address the more complex situations that come up as you take on your residency. Next slide, please. We are a medium-sized practice. We have 7 commissioned doctors, and we currently have 1 resident. Our patient demographics consist mostly of adults, ages 18 and up. We do see some teens on a case-by-case basis. That usually goes based on per provider preference and with prior approval from that provider. As far as the types of patients we see here, our clinic focuses on a variety of specialties and procedures. Obviously, we're a primary care office, but we see GI-related conditions, chronic fatigue, reproductive health and hormones, which we actually also offer hormone pelleting now. PRP and prolotherapy. We do a lot of IV therapy like iron, nutrient, chelation therapy, and more. We do shockwave therapy. And our newest procedure is actually our photona laser therapy, which we use to perform 4D facials, which is like a non-invasive, facial procedure that patients can do. Nightlies, which can help to reduce snoring and help with sleep apnea, which has been super successful and can also even address other health concerns like active acne, recurrent nail fungal infections for patients. So our residency will help you to develop your clinical skills and judgment and also help increase your confidence as a new provider. The way that we set up our clinic for our residents, you will have both time to see your own patients. You'll have time to check in with your assigned doctor at our clinic. And you'll also get individual meetings with me directly to do regular check-ins just to make sure things are going smoothly, or even to address any concerns that you might have. That way we're meeting regularly and on the same page. We like to take a collaborative approach to things. So we are a collaborative environment where support is offered to you at every turn whenever you need it. A main doctor will basically be accessible to you anytime you need the support throughout your residency experience. We also do monthly grand rounds. All of our providers will meet and residents will get a chance to come together and discuss different case studies to help expand on your knowledge as a new practitioner. You'll even have the chance as the resident to invite your own ideas for case studies at the grand rounds as well. And then lastly, as far as benefits and what our residency entails, our residents, we do offer a number of benefits. Our annual starting salary is $61,000. We do offer a 401k with up to 3.5% company matching. We offer both health and life insurance, up to $500 toward continuing ed credits, and a good work-life balance with about a 40 to 45 hour per week schedule, Monday through Friday. We are closed Saturdays and Sundays. And as far as interest in our residency, if you are interested, highly do recommend reaching out to me directly. We can be flexible to set up some time for you to precept with one or more of our providers at our office, just so you can get to know our clinic and we can get to know you too. And that is all I've got. Thank you so much.
Thank you all. I appreciate everyone coming today and staying. I know we ran a little bit long, but next year, we will be hosting a number of different events just to kind of get you on your way and help you understand what are the last little bells and whistles you need to put onto your applications to be prepared. So our virtual Q&A session is on January 25th. That's number 2. So I highly recommend bookmarking that, registering if you haven't already. And this way, you've got a pin in if there are questions that are coming up for you as you're getting ready to press send on your application. And with that, we will wrap up for the day and wish you all the best of luck in your residency applications. Take care.
Thank you, everybody.
Thank you.